Hello, good evening, everyone. This is the session that we would like to do for on residency counseling, and this is our third session in this season. And the first two webinar sessions were done by Dr. Gani, and this is Dr. Sateesh Arja. I am the Executive Dean of Avalon University School of Medicine. And before I start today's webinar session, I would like to thank Mr. Amin for arranging this webinar session and providing the technical support. And we will start as soon as possible. Amin, can you go to the next slide? Okay, in today's session, my complete webinar will be focused on three sections. Those three sections include, one is on USMLE Step 1, and the second one is USMLE Step 2 CK, and the third one is related to the residency counseling or residency interview process. We'll go one by one, and I will be spending around 15 minutes on each section. The last 15 minutes, I will keep it open for question and answer section. If anybody has any questions, you can type, or you can type the questions in the chat box, and Mr. Amin will be communicating with me. I will try to answer all the questions as much as possible. And the first one is USMLE Step 1. The major change that is going to happen with USMLE Step 1 is USMLE and ECCFG remain committed to initial implementation of timeline for USMLE Step 1 pass-fail as no earlier than January 2022. And even we received an email from the NBME today stating that they are committed for this change process, which means that from January 2022, it is going to be pass-fail on USMLE Step 1, which means there will be no 3-digit score on USMLE Step 1 starting from January 2022. So what will happen if once USMLE Step 1 becomes pass-fail rather than 3-digit score? What will happen to the program directors? How the program directors are going to select the candidates for the interview process? Then in that case, what will happen is the emphasis will be given more for USMLE Step 2 CK score, and also letters of recommendation will play an important role, especially letters of recommendation from the specialty of interest. For example, if a student wants to apply for internal medicine residency, they need at least 3 to 4 letters of recommendations. Out of those 3 to 4 letters of recommendations, 2 letters of recommendation can come from internal medicine because they are applying for internal medicine. And the other 1 or 2 recommendation letters can come from subspecialties of internal medicine. The same case with surgery. Suppose, for example, if you are applying for surgery, 2 letters of recommendation must come from surgery, another 1 or 2 recommendation letters from subspecialty of surgery. And that is going to be very crucial because they are going to depend more on letters of recommendation once this change process will happen. And also the other thing which will play major role in selecting the candidates for the interview once the USMLE Step 1 becomes pass-fail is MSPEs. What do you mean by MSPE? MSPE means Medical Students Performance Evaluation, and or it is also called as Dean's Letter, because this is also will be very important once this USMLE Step 1 becomes pass-fail. Why? Because even now also MSPE play a major role in the selection process of candidates for the interview, the Dean's Letter. And actually this year I'm reviewing all the MSPEs that we are submitting for our students. I would like to give some tips for our students when they are submitting the information related to Medical Students Performance Evaluation. So one of the first column that you see on MSPE is noteworthy characters. That means what are the special attributes of you or special traits of you that you would like to inform the program directors that is something special about you. And I have seen a lot of our students writing paragraphs and paragraphs about these noteworthy characters. You know, what we need to know is that a lot of program directors or even the people who are reviewing your application may not have that much time to review your noteworthy characters if you are writing paragraphs. I would like to suggest you, when you are mentioning about noteworthy characters, it's very important to be focused and pinpoint and specific. Suppose, for example, if you want to say that you are a good team player, just say that you are a team player. But if you want to explain that character, maybe you can use like maybe small paragraph, like 2-3 sentences. But please do not write big paragraphs, especially when you are mentioning about noteworthy characters. Because why I'm saying it is because I have seen it this year. That's why I would like to suggest this to all our students, especially when students are preparing their MSPs in the future. And also the other thing I would like to mention about MSPs is when you are mentioning about your research publications. You know, I see a lot of our students are, at least they are mentioning 2-3 research publications on their MSPE. That is very important, and it's I liked it because our students are able to involve in the research process and they are able to publish. But the only one suggestion that I would like to give to the students is regarding those research publications when they are mentioning on MSPEs is that, you know, you need to follow certain format when you are citing the article. That's very important. A lot of students are citing the articles without even following a particular format or standard format. There are many formats to cite an article. Either it could be AMA format or APA format or Vancouver style or Harvard style, whatever the style you would like to select, but it has to be a standard format. But what I see when students are mentioning or citing their articles on MSPE, there is no particular format. But don't expect us to correct those formats. The reason is we can correct all those formats, especially when we are preparing MSPs for 80 to 70 students every year. And that is one thing I would like to mention. Be careful while you are citing your articles on MSP. It should not look like that you don't know what kind of format you should follow when you are citing an article. And also the other thing is research experience. As I said, research experience is going to be very important, and people look at those research experiences. But one suggestion I would like to give to clinical students, especially when they are involving research projects, please select research projects that you can do within the limited time or within the time frame. If you select a research project which can take up to 1 year or 1.5 years, it might not worth it while you are in the medical school. The reason is you need to study for your USMLE Step 2 CK, and also you need to focus on your clinical rotations. Please select a research project that which you can do within like maybe 6 months or maybe maximum 8 months. The other suggestion also I would like to give to the students is that if you are selecting a research project, it's not a bad idea to publish a case report. The reason is it's easy to publish a case report and which you can finish within the timeline as we are discussing. And these are the things that you keep in mind, especially when you are preparing MSPs and planning to do a research project while you are in the medical school. And other change that I would like to mention on USMLE Step 1 is beginning in October 2020, Step 1 will increase the number of items assessing communication skills. This is what already happened. And you can see a lot of questions assessing the communication skills on USMLE Step 1. It is already been implemented. And we have seen that change even with the NBME exams also. Even the students who are taking NBME exams, they are mentioning that there are a lot of questions related to the communication skills, and also there are questions related to practice-based learning and evidence-based medicine. What does it mean is evidence-based means whatever you learn from your epidemiology and research methodology. There are so many questions on odds ratio or maybe retrospective research methodology or prospective research methodology, all those questions. So you can see that change on USMLE Step 1. There are a lot of questions coming from communication skills and even from practice-based medicine. Please, next slide. And here I would like to show you one slide. Here you can find some of the links where you can find tutorial and practice test items and also sample items for USMLE Step 1. And you can find them on the USMLE website. I provided the links here. Please do those sample items before you prepare for your USMLE Step 1 or during your preparation of your USMLE Step 1, because these will be very helpful to you. It's like a kind of practice before you go for actual USMLE Step 1 exam. And other change that has been recently announced by USMLE is they are allowing maximum attempts to take any USMLE exam is only 4 attempts are allowed. Previously it used to be 6 attempts, but now they cut down from 6 attempts to 4 attempts. Other change also announced by USMLE is any student who wants to take Step 2 CS exam must pass USMLE Step 1. Without passing USMLE Step 1, you can take your USMLE Step 2 CS exam. Anyhow, this Step 2 CS exam has been suspended now because of the COVID and due to this pandemic and due to current circumstances, USMLE Step 2 CS has been suspended for around 12 to 18 months. However, please keep in mind that students who are preparing for USMLE Steps 2 CS in the future, you must pass USMLE Step 1 before you take your USMLE Step 2 CS exam. Please, next slide. And here, this is one of my favorite learning pyramid, or I can say the preparation time that you need to spend, especially while you are preparing for USMLE Step 1. The preparation for USMLE Step 1 on this slide, you can see that I divided the whole preparation into 3 phases. The first phase is definitely while you are preparing for your first attempt of NBME, and second phase while you are preparing for your second attempt of NBME, and third phase while you are preparing for your third attempt of NBME. While you are preparing for your first attempt of NBME, you have 5 months time. This 5 months time, which includes 4 months of MD5 and also 1 month after MD5. And during this time, you must spend at least 8 hours per day. And the resources can be Kaplan, Petoma, First Aid, and UWorld, and also NBME self-assessments. These must be your resources while you are preparing for first attempt of NBME. But one suggestion I would like to give you while you are preparing for USMLE Step 1 is that whatever the resource that you pick up, please stick with that resource and use that resource from the beginning of what you call your preparation till the end of preparation. Don't jump from one resource to another resource. I have seen many students jumping from Kaplan to PASS program to what you call the other program, maybe DIT or many programs. They jump from one resource to another resource. Especially if students jump from one resource to another resource, it might create confusion and your preparation will not be neat and clean. But it is very important for you to stick with one resource and follow that resource from the beginning of your preparation till the end of the preparation. And also another question that I have seen with the students is the students saying to me that, can I take my NBME self-assessment maybe while I'm preparing for my second attempt of NBME, or maybe I'm preparing for my third attempt of NBME? No, I would like to suggest you that you take your NBME self-assessments even before you take your first attempt of NBME. You must take NBME self-assessment at least 1 month before your first attempt of NBME, because it tells you what are your strengths and weaknesses based on your NBME self-assessments. And if you know your strengths and weaknesses, according to that, you can modify your preparation for your NBME exams and USMLE exams. That's very important. Please take your NBME self-assessment even before your first attempt of NBME. The same question for UWorld questions also. Students saying to me that I didn't do UWorld questions while I'm preparing for my first attempt of NBME, and I kept my UWorld questions for my second attempt of NBME or third attempt of NBME. There is no keeping here. And I would like, you don't need to store or you don't need to set aside your UWorld question for your second attempt of NBME or third attempt. Please start doing UWorld questions during your preparation for the first attempt of NBME itself. And you can see the second phase. For example, if you have passed your NBME exam on the first attempt, that's fine. It's very, very good and well. And you can go ahead and register for USMLE Step 1. But for example, if you cannot make it on your first attempt of NBME, then you are required to prepare for your second attempt of NBME. And this second attempt of NBME, you will be taking 3 months after first attempt of NBME. During this time period, you must spend at least 10 to 12 hours per day. But at the same time, if you want to what you call use the resources, the same resources should be there. Kaplan, Petoma, First Aid, UWorld, and NBME self-assessments. And as I said, if you pass on your second attempt of NBME, that's fine. But if you don't make it on even on second attempt of NBME, then you are required to take your third attempt. While you are taking third attempt of NBME, you will be given 2 months of time. Here also, your resources will remain the same. And I have heard from students saying that I don't want to use the Kaplan. I would like to use the Boards and Beyond instead of Kaplan. That's fine. You are free to use Boards and Beyond instead of Kaplan, but you should stick with that resource, Boards and Beyond, all the way throughout your preparation. That's very important. And also another thing is, while you are using Kaplan, you should also supplement Kaplan with Petoma. The reason is pathology is not that great in Kaplan. So maybe for pathology portion, Kaplan may not be sufficient. You should be able to use Petoma along with Kaplan, especially for pathology, right? So you should be able to use Pathoma, and Kaplan should be able to be supplemented with Pathoma. This is the goal line resources for your USMLE Step 1 and NBME preparations: Kaplan, Pathoma, First Aid, UWorld, and NBME self-assessments. I don't want to miss any resource out of this. You should be able to do everything. Please, next slide. And this is also one of my favorite slides to show for the students who are preparing for USMLE Step 1. Here you can see that I divided the whole preparation for USMLE into 9 blocks. You can see first 8 blocks include 8 systems. The first system is cardiovascular system, respiratory, renal, gastrointestinal system, endocrine and reproductive, and central nervous system, musculoskeletal, and blood. These are the 8 organ systems that you must prepare while you are preparing for USMLE Step 1. And why I divided these 8 systems, the reason is when you look at NBME reports, or if you look at the USMLE reports, the maximum number of questions will come from pathology, physiology, and pharmacology, as you already know it. And they are saying, or they are quoting pathology questions, and also pathophysiology questions can come anywhere between maximum 40 to 65%. And when it comes to the physiology, it can come anywhere up to maximum 27%, and pharmacology up to maximum of 25% of the questions. So your preparation, most of your preparation includes physiology, pathology, and pharmacology. So suppose, for example, if I'm preparing for cardiovascular system, you must prepare your physiology and pharmacology from Kaplan and pathology from Pathoma. The same thing for all the systems. For example, if I am preparing for central nervous system, your physiology or neuroscience, whatever you call neuroscience of central nervous system, and pharmacology of central nervous system should come from Kaplan, and pathology portion of central nervous system should come from Pathoma. And these 3 subjects in each system should be thoroughly prepared. And after you prepare physio, path, and pharmacology, you must practice questions. While using or while practicing questions, you must use UWorld and Kaplan Q banks. Okay, each system, how much time I can take? Maybe 1 week. So 8 systems will take up to 8 weeks. So after I'm done with 8 systems, I go with other courses. What are the other courses that I still require to do? You're required to do microbiology and immunology, which can take up to another 1 week, anatomy, which can take up to another 1 week, behavioral science and epidemiology, and including ethics, and all those things can take up to 1 week. As I said, biochemistry and genetics also can take 1 week. So microimmuno, anatomy, behavioral science, epidemiology, biochemistry, and genetics can take up to 4 weeks. So if you include 4 weeks plus 8 weeks, which is total 12 weeks, which is exactly 3 months. And these 3 months should be your preparation after your first attempt of NBME, while you're preparing for second attempt of NBME. Please, it's very important for the students to pass USMLE Step 1 and NBME exams. The reason is USMLE Step 1 is people say that that is one of the most difficult exams, but once you pass USMLE Step 1, your life will be totally different. And I'm sure once you go to the clinical rotations with passing USMLE Step 1 score and with passing USMLE Step 1, your body language will be different and your confidence levels will be different, and you will be doing very well in clinical rotations. And if I go to the clinical rotations without passing Step 1, definitely, your confidence levels will be low. And it's very important for us to have that confidence levels and do well during clinical rotations. Because the reason is, if you do well in clinical rotations, you get good recommendation letters. And that is very important. LORs are very important while you are applying for residency. That's why I say that, it's very important for you to pass USMLE Step 1 and continue with clinical rotations. Next slide, please. Any questions? If you have any questions, you can send us questions in the chat box. And the next slide here, I would like to mention something about what you call your USMLE Step 2 CK. And beginning in November 11, 2020, Step 2 CK will increase the number of items assessing system-based practice, patient safety, legal and ethical issues, and professionalism. That means in a week, we are going to see some changes on Step 2 CK. So what changes? There will be an increased number of questions on system-based practice, patient safety, legal ethical issues, and professionalism. And also I kept some links here on this slide. You can see these links. And these links related to sample items related to the Step 2 CK and also content description of Step 2 CK, which is available on the USMLE website. And you see the link, and you can take that link and you can click on it, and then you can see the sample items. These sample items for Step 2 CK has 120 question items, and these sample items are very much similar to the Step 2 CK exam, so it will be very helpful to you while you are preparing for your USMLE Step 2 CK. And please do these sample items. Don't regret for yourself after finishing your Step 2 CK exam. Don't feel like learning from somebody else. There are sample items available on the USMLE website, and I didn't do it. You should not regret like that. These are available and everybody can do it, and these 120 questions are very useful while you are practicing for your Step 2 CK. Next slide, please. And what are the resources that I can use while you are preparing for your USMLE Step 2 CK? The different resources are UWorld and online med-ed videos. And I'm sure most of the clinical students might know that there are online med-ed videos are available. And not only they are available, and they're very useful to the students. Many students mentioned to me that they got very much benefit from online med-ed videos. And the important thing is they are free for clinical students. And of course, they are free for any student. Please utilize those online med-ed videos. They are very useful for your clinical rotations. Not only they are very useful for clinical rotations, and they are very useful for your Step 2 CK preparation. And other resources that you can use for Step 2 CK preparation are Step Up to Medicine, Surgery, Pestana, Obstetric and Gynecology case files, first aid, and NBME self-assessments. Not only that, a lot of students, clinical students that I have seen, they take the shelf exams very lightly. Don't take shelf exams very lightly. You have a shelf exam at the end of each core rotation. For example, if you finish internal medicine, you're going to take shelf exam, which carries 20% of your grade in internal medicine. But many students think that this is only 20%. But I tell you, if you prepare for shelf exam, you're preparing for yourself for Step 2 CK exam. That's why it's very important for the students to prepare for the shelf exams, which ultimately will help the students for their Step 2 CK preparation. Please, next slide, please. And here, the most important announcement, especially the students who are applying for matching process for this year, because they need to get ECCFG certificate. How can they get ECCFG certificate when they are not able to take Step 2 CS exam? As you all are aware of that, Step 2 CS exam has been suspended for 12 to 18 months. So how Avalon graduates are able to get ECCFG certificate? Because we fall under pathway 3. According to the pathway 3, our graduates are able to get ECCFG certificate. But of course, there are some conditions need to be met. And the reason why Avalon graduates are able to take what you call are able to get this ECCFG certificate under pathway 3 is because Avalon is a accredited medical school. And we are accredited by both ACCM and CAMHP. Because we are accredited medical school, we fall under pathway 3. And to qualify for this pathway 3, and anybody who is applying for this residency this year and want to get ECCFG certificate, and they haven't taken Step 2 CS exam yet, or maybe they might have failed Step 2 CS exam on the first attempt, and they want to get what you call ECCFG certificate, you can do that. But for that, you need to submit your application. So you can see the link available on this slide. You can click on that link. You can submit the application. Once you submit the application, it will be submitted to the ECCFG. But it is not only you submitting the application, but we also need to attest your clinical skills. Actually, I already started attesting some students for clinical skills attestation form. And this clinical skills attestation form has to be sent to the ECCFG directly from the school. The deadline for you to submit the application is December 31st, 2020. But for the school to submit the attestation form is January 31st and 2021. But we have set up our own criteria according to the ECCFG and USMLE guidelines. In order for the school to attest your clinical skills attestation form, you must do 3 core rotations with Avalon, and you should submit, or you should have 3 evaluations from 3 core rotations. That's important for us to look at it. When you are submitting the evaluations for core rotations, we look at CCEs and also the evaluation from the core rotation. At least 3 evaluations are required from core rotations. Suppose in case a student may not finish what you call 3 core rotations with us, is there any other way that they can satisfy clinical skills attestation form? Is filling out the mini CX form. Mini CX form is also available on the ECCFG website, and you should give this mini CX form to your preceptor, and preceptor should observe you while you are doing a patient encounter, and the preceptor will fill the mini CX form and he will sign it. But how many mini CX forms we need? We need at least 3 mini CX forms are required. And you must get these 3 mini CX forms from 3 different preceptors, not the same preceptor, 3 different preceptors. And those 3 preceptors should be affiliated with Avalon. That is also very important. And one of these encounters, 3 encounters that you do with 3 mini CX forms, one encounter must be on the general hospital service. That is also another requirement for us to attest the clinical skills attestation form. In a nutshell, for the students or the graduates to get ECCFG certificate, they can apply under Pathway 3. And this Pathway 3 requires 2 things. One is application from you. That application should go to the ECCFG before December 31st and 2020. And the school should attest your clinical skills. And we can attest your clinical skills under 2 conditions. One is we should have at least 3 evaluations from 3 core rotations, or 3 mini CX forms filled by 3 different preceptors when preceptors observing you while you are doing encounters. And also there are other requirements also, not only this, that you need to pass OET exam. That means occupational English test also you must pass. You must pass USMLE Step 1 and Step 2 CK. These are the requirements for you to be getting ECCFG certificate without taking Step 2 CS during this pandemic or during these corona circumstances. If you have any questions regarding this clinical skills attestation form or Pathway 3, anything, you can send me an email. You can send me I'm giving you my email on this slide. You can send me an email and I'm happy to answer your questions regarding this clinical skills attestation form and also regarding this Pathway 3. Please, next slide. And this slide has taken from American Association of Medical Colleges, and this slide includes all the timelines pertaining to the match season this year. On 8 June 2020, ERAS was opened at 9 o'clock, and 23rd June, ERAS started giving tokens for international medical graduates. And on 1st September 2020, even why I'm saying all these timelines here and there, they will be the same every year. Only 1 or 2 days, maybe here and there will be changes, but otherwise timeline will remain the same. And applicants should start filling out the applications on ERAS application process starting from 1st September. And when you start filling the applications on 1st September, before 1st September itself, you should keep ready with all the materials available and the documents you're required to submit. Don't think that I will start the whole process from September 1st. You should keep all the documents and the materials be ready even before the 1st September. And on 21st October this year, the residency program start downloading your applications and also the MSPs. We submitted the MSPs of our students. That means Dean's letters. MSP means, don't get confused. What is this MSP? MSP is nothing but medical student performance evaluation, which is also called Dean's letter. We also submitted these MSPs to the ERAS and to the residency programs even before what you call 21st October. And then what happens after the programs download your applications and your materials, they download, then they select the candidates for the interview, and the interviews will be going on. The interviews will start maybe in the middle of November or somewhere in November, the interviews will be starting, and the interviews will be continued up to the end of January. And then after the end of January, coming from 1st February, the ranking opens. You start ranking the programs. And this ranking will close by 3rd March 2021. So this year, the rank order list will be closed by 3rd March 2021. And the big week, the match week that happens between 15th and 19th of March 2021. That is the match week period. And during this match, and one thing about this matching process is this time they added one more additional SOAP process. What do you mean by SOAP process? You know, generally some of the programs might be unfilled, and you can apply for those unfilled programs. And these unfilled programs will be receiving what you call applications from you during the SOAP process. And suppose, for example, unfortunately, if you didn't match, you can go through the SOAP process. And also programs will contacting you when they see your application. If there are unfilled positions, they will be contacting you also. That will happen during the SOAP process. Generally, there will be 3 rounds of SOAP process every year, but this year there is going to be 4th round also. That is one thing special about this SOAP process in this year. They have added another round of SOAP process, 4th round of SOAP process. The reason is they want to fill unfilled positions as much as possible. And what happens on 30th June, ERAS season ends, and my ERAS closes at 5 o'clock on 30th June 2021. That's what happens on 30th June. This is just a glance of timeline. You can look at it. And the June, where the ERAS opens, 1st September, you start filling the applications, submitting the applications and documents. And 21st October, the program start downloading your documents and applications and all those things. And 1st February, rank order list will open. 3rd March, rank order will be closing on 3rd March. So there is a timeline. It's not only the timeline important for the people who are applying for the matching process this year, but it will be very useful for even for the students who are applying for the matching process in the next year also, because most of the times the dates will remain the same except 1 or 2 days change, 1 or 2 days here and there. Please, next slide, please. And in this slide, I would like to mention some of the important things that is very important for the people who are applying for residency and all those things. And this is not my data. This is the data released by NRMP matching process people. They release this data and they interview the program directors, and they ask the program directors, what factors do you look at when you are selecting a candidate for an interview? And they, you know, just I'm putting some of the important factors here. The most important factor so far is USMLE Step 1 score. 90% of the program directors mentioned that they will consider USMLE Step 1 score as an important factor while selecting the candidate for an interview. But this might change after 2022, as we discussed. From January 2022, you don't see the 3-digit score. It's only pass fail. Maybe after that it will change, but for now it is the USMLE Step 1 score which is the most important thing. And the next one is letters of recommendation in the specialty. This is very important. 84% of the program directors mentioned that letters of recommendation play an important role while selecting a candidate for an interview. Definitely 84% of the people, program directors mentioned that. You know, I mentioned to you that letters of recommendation will play a role when USMLE Step 1 becomes pass-fail. But don't think that only it will be an important when the USMLE Step 1 becomes pass-fail. Even now also, it's very important to have good letters of recommendations, and especially within the specialty that where you would like to apply for residency program. And the next one is Step 2 CK score is also very important. 78% of the program directors mentioned that Step 2 CK score play an important role. Then personal statement, again, it is also 78% of the program directors mentioned. And MSPE and Dean's letter, 76% of the program directors mentioned that MSPE and Dean's letter play a role in selecting the candidate for an interview. I told you, MSPE and Dean's letter, very crucial for the residency process. And this play an important role when USMLE becomes pass-fail. But what I'm trying to tell you here is that even with the 3-digit score of USMLE Step 1, currently what we are doing is also there is a role for MSPE Dean's letter, because 76% of the program directors mentioned that this Dean's letter play a role selecting a candidate for an interview. So these are just I'm putting what you call the important factors for the program directors while selecting a candidate for an interview. Next slide, please. Okay, so you are selected for an interview and you do an interview. So what happens? You know, what factors play an important role while selecting the candidates after the interview? You can see here So what are the important factors which play an important role after what you call our interview? Interpersonal skills. 95% of the program directors said that good interpersonal skills is very important for us to select a candidate after the interview process. Interactions with faculty during interview and visit. Interactions with house staff during interview and visit. And this, I'm going to mention about these things in my next slides also, but please remember all your interactions with the faculty and house staff and maybe whoever it is, it should be very polite, professional, courteous, and all the time professionalism. And you need to be pleasant, that's very important. And another important factor while selecting the candidate after the interview is feedback from current students. Feedback from current residents. 88% of the program directors mentioned that feedback from current residents also play an important role. Again, you can see letters of recommendations in the specialty, 78%. So, you can see that USMLE Step 1 score is important, letters of recommendation is important, and MSP Dean's letter is important, and interpersonal skills and our communication with the faculty and residents. These play a big role when you are applying for residency or when you attend an interview. These play an important role for you to get into the residency. That's very important. Please, next slide. Yes, from now onwards, I'm going into the last section of my webinar today. So this last section is virtual residency interviews. What will be the virtual residency interviews? Why virtual residency interviews play a role? I will tell you, under the current circumstances due to pandemic, there are very little chances to have face-to-face interviews. I doubt if any program will conduct face-to-face interviews this year and probably next year too. I'm just guessing next year, but nobody can guess what happens in the next year. But this year, there will be no face-to-face interviews. If I'm right, and I'm sure, it's tough to conduct what you call face-to-face interviews. So it is going to be the virtual residency interviews. What do you mean by virtual residency interviews? The interviews will be conducted online through online platforms. And WAMC, the link I have provided on the slide, American Association of Medical Colleges, they provided instructions for the candidates to prepare for virtual residency interviews. You can go through the document. It is available on the AMC website. You can go through the document, but even though you can go through the document, I made a summary of what you call these virtual residency interviews and how you should prepare for virtual residency interviews. Because the reason is, you are not going to be there personally to speak with the faculty member or to speak with the resident or to speak with the program director or associate program director. You are going to do the interview online. So they are going to assess you in the interview process. Even though it is online, they can assess you, when you do those interactions on the virtual residency interview, they can assess you. Still, they can assess you. And the questions that you see on the virtual residency interview, even for normal residency interview also, the questions that you can see is, the questions can be you can see there are three types of questions that you can see with the residency interviews. Those three questions are behavioral questions, general questions, and situational questions. What do you mean by behavioral questions? The behavioral questions can be like this. Please describe a time when you observed a member of the medical team you were working with behave in a manner that was inconsistent with an established protocol. Maybe he's not behaving as per the established protocols or regulations. What would you do in that situation? This is an example for a behavioral question that can be posed on the virtual residency interview. But they can frame many number of questions. But I'm giving you an example for you how the behavioral questions can look like. The next slide, please. And the general questions, general questions. What do you mean by general questions? These general questions can be anything which can be of general in nature. Suppose, for example, tell me why you are interested in this program. Like that, they can ask you a question because they want to see your commitment to the program and also your interest in the specialty. This is very important. You have to reflect this, your interest in the specialty or your commitment to the program, why you are interested in that program specifically, why you are interested in that specialty specifically. This should be reflected on your CV. This should be reflected on your personal statement. This should be reflected on your what you call your during your interview also. That's why they would like to see why you are interested in this program. And the next type of question that you can see with the residency interview, situational questions. What do you mean by situational questions? For example, they can ask you a question like this. Imagine you are on your morning rounds. The chief resident describes a difficult case you and a colleague worked on earlier in the week and compliments you handling of the situation. She gives you a sole credit and fails to mention that your colleague played a major role. So she didn't give you the what you call credit for your colleague, but she gives you the entire credit. What would you do that in that situation? That is called situational questions. And I'm sure maybe some students might know that situational judgment is very important, and it is valid and it is reliable. A lot of program directors or even associate program directors, they depend on assessing the candidates based on these situational questions. This is called a situational judgment test, SJT. They are very valid and reliable. They feel that they are very valid and reliable in assessing the candidates. Actually, these SJTs are even used even for the admission of a medical school also. They can be used even for a medical school also. The same questions, but it is a different level, and different set of questions can be used even for selecting the candidates for residency. These are called situational questions. You should be ready for any kind of questions, either behavioral questions, general questions, or situational questions. You should be able to answer, and your questions, your answers should be relevant and appropriate and should be professional. The next slide, please. Okay, before you prepare for your virtual residency interview, what information you should gather? This is very, very important slide in my opinion, especially for the graduates or students who are preparing for this residency interview this season. It is going to be virtual interview, so maybe you should gather all this information before you prepare for residency interview. You should ask the program whether it is a live interview or a synchronous interview. You should ask the residency program people, whether it is a live interview or a synchronous. And I'm sure you all know what do you mean by live interview. That means you will be interviewed by 1 or 2 interviewers, and you will be asked questions, and they will be assessing you while you are answering the questions. But what is the meaning of a synchronous interview? That means what will happen here is the program will send you a list of questions, maybe 8 questions or 10 questions. They can ask you to answer those questions and record it and send it back to us recorded video. That is called a synchronous interview. And here you may not have anxiety or stress facing an interviewer, but still you need to do good interview even with the synchronous interview also. But please find out the programs so that you can prepare well, whether it is a live interview or an asynchronous interview. And other thing is, you should ask the program video interview platform, what kind of platform they are going to use. This is also important for you to know, whether they are using Zoom or maybe WebEx, or maybe they are using a GoToMeeting. You never know what kind of application they are using. You should ask them what kind of program are you going to use, and so that you can prepare accordingly. Maybe some programs might use Zoom, some programs might use WebEx. Maybe if I am there, I might use what you call GoToMeeting. So you can ask them what kind of platform they are going to use for virtual residency interview. And other important question is number of interviewers. What does it mean? You can ask them how many interviewers are going to interview you for the program, for the residency interview. Sometimes program directors can use 2 interviewers or maybe 3 interviewers. One can be the faculty member, one can be the program director or maybe associate program director, and one can be the chief resident or any other residents. So you can ask them how many number of interviewers will be interviewing you for the residency interview. And maybe you can ask politely even the length of the interview also. It's very important for you to know how much time they are going to take for a residency interview, so that you can prepare according to that. And types of interview questions, you can gather that information. Some of the information you can ask the programs, and some of the information you can find on their website. And I would like to tell you, the people who are applying for residency this year, they are stressed out, or maybe they are worried, or maybe they are anxious how the virtual residency interviews are going to be. Equally, the program directors are also, what I can say, not stressed out, but they are also a little bit anxious how they are going to do these virtual residency interviews, how they are going to select. Even they are also thinking how to promote their programs. I have seen program directors discussing at many forums. They are saying that they are using all kinds of social media these days to promote their program. They are using Zoom, they are using Twitter, LinkedIn, whatever the platform they can use so that they can promote their even the website. Please check their website. Please check their Twitter handle, check their LinkedIn handle, and see what they are posting and what information they are giving to the candidates. Look at all those things, because as I said, even the program directors are also want to promote their programs. They are working very seriously to promote their programs, to recruit residents this year through the virtual residency interviews. And also look at the programs, see what competencies or skills they are going to assess. It's very important for you to prepare for the interview. So these are the questions. Please make your homework, make your background work. Don't just attend the interview. Do the all the background work that you can do. You can collect all this information from the programs, or you can collect this information from their website, or as I said, social media platforms. Get as much as information as possible. It will be very helpful for you to prepare for the residency interview. Please, next slide. Okay, so you have found all these. You know that the program directors are going to assess you maybe 4 competencies or 5 skills. What I'm going to do with that? And please try to reflect your CV for each competency or for each skill. For example, they are going to assess your professional behaviors, or maybe they are going to assess your interpersonal communication skills. What you have written about these skills on your CV, reflect and try to recall your experiences. Maybe you might have very good experiences regarding these competencies during your clinical rotations. Try to recall those experiences so that you can use these experiences while attending the interview. You can explain your experience to the residency interviewers so that you can explain them, this is what happened, this is how I did during my clinical rotation. So these experiences are very, very important for you to recall and recollect. But at the same time, look at your CV, what you have mentioned in your CV, because everything has to cross match. As I said, your CV, personal statement, and your experiences and your competencies or skills should be reflecting the same. Okay, please try to recall your experiences. Don't, as I said, please do your background work because now whatever you could do, you already done. Your USMLE Step 1 score is done, your Step 2 CK is done. You're not going to change it. Those are unchangeable. But what you can change, your performance during the interview. But for that, you need to have good background work need to be done. So do all this work before you go for the residency interview. Please, next slide, please. And during the interview, what you should make sure while you are attending the interview, have a stable internet connection. This is very important. And make sure that you have a stable internet connection while you are attending the interview. And use computer or tablet, that means laptop. I may not even recommend iPad or iPhone for conducting an interview, because please stay away from the phone, because it's recommended using what you call a device that is acceptable, like computer or tablet. Maybe even the programs also might mention to you, don't use the phone for your interview purpose. So please use a computer or laptop. And another one is a private and quiet and well-lit space. That's very important. The light in your room where you are going to conduct the interview should be appropriate. That's very important for me. Especially don't have like what you call very dazzling backgrounds. Don't have what you call too much light at your background, and they should be able to see you. Okay, the next slide, please. And double check your microphone and camera, because they should be working. Because when you are attending the interview, your microphone and camera should working. Position your camera and microphone as you did when you practiced. It's very important statement here what I made. So you to position your camera and microphone as you did when you practice. That means you should do a practice session before you go for actual interview. Do the practice session. Maybe you can set up your camera and microphone even with your practice session so that you can use the same position of the camera, and you can use the same volume of the microphone so that you can conduct an appropriate interview. Shut down all programs on your device. So the no alerts, no notifications, no electronic interruptions. This is very important. Whatever suggestions I'm giving here regarding virtual residency interviews, these are all recommended by well-known people in the field, in the medical education field. It came from WAMC and also the Organization for Society of Directors in Research in Medical Education. They always discuss about these things. All these recommendations have come from them. Use all of those things, and so that you can make a great interview. And have a backup plan in case the technology fails. This is also very important. Suppose, for example, if the technology fails, maybe you should have a backup plan. Maybe you can give your phone number to the program, so that maybe to interviewer, especially in advance, you can give the phone number to the interviewer in advance. Suppose in case technology fails, they can call you on the phone. But to begin with, don't use the phone. Only in case of emergency, you can use the phone if the technology fails. Please, next slide, please. So as I said, while you are conducting the interview, identify a private, quiet, well-lit space, which I already mentioned. No background noise, so avoid open spaces. Don't do it in the libraries. Don't do it in the coffee shops. Please do it in your own private room, where you can have what you call a calm and quiet environment. And even some of the medical schools in the US, US medical schools, they are planning to arrange interview rooms for their own students so that they can attend the interviews. But for us, we are international medical graduates and Caribbean medical graduates. We are spread all over, which is not possible with us. But you need to have your own private space where you can conduct an interview, where you can do an interview in a calm and quiet environment. And avoid having resources like bright light. And also, when you are putting background, some people use the artificial background while doing what you call these virtual interviews. I don't recommend artificial background. It is better to have what you call white, neat, clean wall might be better, rather than having what you call dazzling background. And always keep an outlet nearby you in case your charging is out. Maybe you can use that outlet for charging your computer or laptop. Please, next slide. And as usual, dress professionally as you would for as in-person interview. This won't change. And also maybe try to be rested and focused as any formal interview, because you would like to do this virtual residency interview same as your personal interview. And while you are doing this virtual residency interview, there could be a chat option available along with Zoom or maybe WebEx, or in some of the applications you can find chat option. You can use the chat option. There is nothing wrong in using chat option, but limit the using of chat option, because there is a chance that maybe people can think that you don't speak much, or maybe they think that you can be an introvert. That's the reason why you are doing chat. So maybe you can avoid that, what you call chat, as much as possible. But if it is required, you can use the chat box. Please, next slide, please. And this last, what you call slide, before we finish up, try to focus on providing detailed examples of behavior that you engaged in from your experience when responding to the questions. This is very important. Give detailed examples. Don't be vague or such thing. You can be what you call giving what you call detailed experience while you are doing the interview. Use clinical and non-clinical experience in your responses as appropriate. Provide detailed responses and try to avoid speaking in generalities. Don't give what you call experiences in a general situation or in generalities. Typically, one strong example is better than several weak or tangential examples. As I mentioned to you, while program directors while the program is assessing you in a particular competency or skill, you can give very good example for that competence and skill. Don't go general explanation. Do not provide patient information that could be used separately or in combination to identify a patient, such as names, locations, diagnosis, or other distinguished characteristics. Refer to patient as the patient. And also, if your response may portray a colleague in a negative light, do not provide information that could be used separately or in combination to identify that colleague, such as name, title, location, or other distinct characters. But I prefer not to say anything negative about other colleagues. You don't need to give much what you negative input about your colleagues, except as we discussed in the behavioral questions, or maybe in some situations they can ask you, what would you do if your colleague is not behaving properly, or maybe if he's not following the proper protocol or regulations, what would you do in those cases? Maybe you can give the examples. Otherwise, I would stay away from negative comments about colleagues and peers. Next slide. And the last slide, some important resources for people who are preparing for virtual residency interviews. I put all those resources here. You can take the, if you want the PowerPoint, you can mail us. We can supply the PowerPoint for you, and then you can, you can get the PowerPoint and you can see the resources. Before I finish my PowerPoint regarding the virtual residency interviews, I just would like to tell you one thing. Be prepared for virtual residency interview and do the background work and collect all the information, reflect your CV, reflect your experiences, prepare for the interview, and do well on the residency interview, because it's very crucial part in your life. And don't think crazy, but I can tell you that in extreme cases, because of these virtual residency interviews, some of the programs can even present a standardized patient. They can ask you to assess the standardized patient online. Is this possible? I'm not saying that all the programs will use the standardized patient to assess your skills or competencies, but there might be some programs which can use standardized patient. Maybe 1 or 2 program directors, maybe they can think like this: oh, this year is very weird year. I didn't have Step 2 CS. Step 2 CS has been suspended. I'm not doing face-to-face interviews. I'm doing virtual residency interviews. There is always possibility the program directors can think like that, and they can say that, okay, let me use one standardized patient to assess the skills and competencies of the students. Maybe they can think like that. They can give you that. So that is an extreme case, but I'm hoping that extreme case, what you call, may not be you. It can be possible. Be prepared for all those situations. Next slide. Yes, that's about my PowerPoint for today, and I hope you enjoyed the webinar session, and thank you for attending the webinar. And if you have any questions anytime, you can send me a mail or message. My email ID is available here. You can send me your messages. I would like to answer your questions. And I would like to thank you everyone, and also Mr. Amin for arranging this webinar and providing the technical support. Once again, thank you, Mr. Amin. And if there are any, if there are any questions that you got, if anybody asks questions, I would like to answer those questions if possible.
Absolutely, Dr. Arja. It seems like we have received quite a few questions. So I will start with first question. Will there be a chance that clinical department asks a student to write our own MSP, or how does it work when we need to write about our traits research on MSP?
Yeah, it's a very good question. MSPE has a lot of information. Most of the information will be written by the school. Like your performance for during your preclinical courses, like during basic sciences, that evaluation will come from the school. And even your performance during clinical rotations, we look at your clinical rotation evaluations, we take the comments from the clinical rotations evaluations, and we keep the same comments on your MSPE, because we have to take the comments from the clinical. That's why clinical evaluations will be very important. But some of the information that the student is required to provide us, for example, what are the specific characteristics, noteworthy characteristics that you think that is very important, and which is very unique about you, and which is very special about you. We can ask those kind of questions to the student. They can provide maybe 3 or 4 special characters. Suppose, for example, I have seen students saying that I'm a very good team player. Yes, that's definitely a noteworthy character. And some students say that I have very good, what you call, communication and interpersonal skills, and I'm very good at it. Definitely, it's a good trait to put it under noteworthy characteristics. And some students have mentioned that, what you call, I have great perseverance. I'm very persistent what I'm doing. I keep doing it. Yes, definitely perseverance and doing things constantly and consistently and persistently is very important. So we keep all those things under noteworthy characteristics, but we ask the students to see what students can come up with it. Noteworthy characteristic. That is one thing. And research publications, this is something has to come from the students. I don't know what research publications have been done by the students, right? We don't know. We ask the clinical students to submit their research publication to us. Most of the times the clinical students will send a copy of the research publication, but sometimes they don't submit. But what we do is, before writing the MSP, we contact the students. Please mention your noteworthy characteristics, and also please mention the publications that you have done so far. So students are required to provide those information to the school so that we can keep on the MSP, so that it's the complete information. 75% of the MSP, 75 to 80% comes from the school. Only 15 to 20% come from the students. Like as I said, noteworthy characteristics and research publications. And sometimes, students want to mention their achievements during the basic sciences. Yes, that also should be mentioned by the students. For example, a student achieved award of excellence in human structure and function, and which we may the person who is writing the MSP, he may not know it, but you as a student, you can remember that. You can mention to us that yes, we received an award in HSF. Then we check it out. We check with our records, and then we see if whether the student actually received the award of excellence or not, and then we put it on the MSP. And one more important thing is also, before we submit the MSP to the programs and eras, and we ask the student to review the MSP. And if the student thinks that there could be something not right, or maybe the student would like to mention some change, they can always contact us and they can do it. And I tell you, it's a lot of work preparing MSPs. And I must thank the clinical department, especially Miss Marissa this year. She prepared all the MSPs, and I worked with her and I reviewed all the MSPs along with her. And we submitted all the MSPs possible, as much as possible, before October 21st. So it's a lot of work, but we try to work with the students, and students has to provide the information, and we work with the students. I hope this answers. Yeah, I hope this answers the students' question.
Absolutely, I believe so. The next question is it mandatory to wait for 3 months before the second attempt of NBME? If someone feels they are prepared before 3 months, is it possible to schedule it?
Yes, absolutely. If the student thinks that he is ready or she is ready for taking second attempt of NBME or third attempt of NBME before the timeline, if the student thinks that they are ready, yes, we do allow that. But student should assess himself that he is ready for what you call this NBME second attempt or third attempt. It's allowed. We do that. And also for that purpose, also I always encourage the students to take NBME self-assessments. Take your NBME self-assessment, see how you are performing, and if you're doing good job on NBME self-assessment, why not? You can take your second attempt of NBME very earlier. And also one of the important question most of the students ask is, when I can take my USMLE Step 1 once I pass my NBME. This is also one of the questions very commonly asked by MD5 students and students after MD5. Suppose, for example, you pass NBME, then you have to register for USMLE. You have to go to the USMLE website and you have to register for it. Not only that, once you register, the application will come back to the school for the verification. So we verify that this is our student, and we certify that student that he can go for what you call, or she can go for taking USMLE Step 1. And then we have to verify that student. And that will take like time, it could be anywhere from 2 months, minimum 2 months. So that 2 months, the students can utilize it for preparing for their USMLE Step 1. Still you passed NBME, you are not sure of USMLE Step 1, so still you have time for 2 months. You can prepare for your USMLE Step 1.
Thank you. The next question is, can school help us to set up some counseling type of session with our current residents from our alumni, at least to current clinical students, as you guys set up for Step 1 counseling from current clinical students?
Oh, you mean Step 1 counseling for clinical students or Step 2 counseling? Is it?
Yeah, I can repeat the first question, Dr. Arja. Can school help us to set up some counseling type of session with our current residents, from the alumni, at least to current clinical students? It
Yes,
is.
definitely. That's one thing what we are planning, and it's in the process still, I can say that. But what we have done so far, I would like to tell the students is that, what we have done is, for USMLE Step 1, what we did is we approached the clinical students, who have passed USMLE Step 1, ask them to be the mentors for students who are preparing for USMLE Step 1. The same thing we can do for even for Step 2 CK, or even for clinical students also. Maybe we can approach the alumni, or maybe people who are in a residency. Maybe we can ask them if they would like to be uh, uh, the mentor for the clinical students. Yeah, this is something which we should definitely think about it. And I would like to mention about these webinar sessions also. We decided these webinar sessions will be done every 2 months, and please keep using it, keep attending it. It may not be the same person who is doing the webinar every time. We decided to do 6 webinars a year, and 3 will be done by Dr. Gani, and the other 3 will be rotated between other members. One time me, maybe one time Dr. Wilson, or maybe one time maybe graduate. We are planning to use even the graduates or people who are in residency to do these webinar sessions. So one of the webinar sessions, maybe one in December or probably one in February, can be the graduate, or can be an alumni who already finished residency. So those people also can help the students. We are planning for that also.
Thank you. The next question is, if we have 3 evaluation already from core rotations, do we still need 3 mini CX form?
No, if you already have 3 core rotations evaluations, then you don't need mini CX forms. So
Thank
far,
you.
I can tell you that I received 11 requests from clinical students to certify for this clinical skills attestation form. I already submitted for 8 students. All we need is either 3 core rotation evaluations or 3 mini CX forms. But those 3 core rotation evaluations must be from Avalon. That's the only thing that what we need. Because if it is a transfer student, and if it is core rotation evaluation from another school, I may not be able to consider. But those 3 core rotations evaluations from Avalon and certified by the Avalon preceptors, then we can certify that student. Then you don't need mini CX forms. So bottom line is either 3 core rotations evaluations from Avalon or 3 mini CX forms from 3 Avalon preceptors.
Thank you, Dr. Arja. The next question is, should we start research experience in basic science or during clinicals?
I would recommend start doing it from basic science. As I said, some of the research projects might take quite lengthy time, because don't think that I should be able to publish in 2 weeks or 4 weeks. Then that paper doesn't carry the quality. You should look at minimum optimal timeline, maybe 4 weeks. Maybe some people spend 6 months. I'm so not 4 weeks. I'm sorry, 4 months. 4 to 6 months. Yes, maybe 8 months you need to spend. Maybe you should start working on research project. Maybe you should align with one of the mentors available on campus. There are a lot of faculty members who are interested in doing research. You can sign up with one of the faculty members, start doing it while you are in the basic sciences. So then what happens is, maybe you might publish 1 or 2 papers in basic sciences and do 1 or 2 in clinicals. The reason is, I would recommend at least 3 publications before you finish medical school. And this is not my data. This is the data that we have taken from I think last year or before last year. The average number of publications published by matched residents, people who matched residency, the average number of publications anywhere between 2.5 to 3. And even unmatched students also have research publications around 2.5 to 3. That means everybody is trying to publish something. And if you publish quality papers, it's well and good. And try to publish something, and publish at least 3 papers before you finish the medical school.
Thank you. And since this is the last question of this evening, and other questions are there, but it's already the repetition of the question which Dr. Arja already have answered. So I will ask this last question of this evening. Would it be possible to provide information regarding the format of clinical rotations?
Yeah, definitely. Why not? Because if some students want to know the clinical rotations, definitely I can provide. We have clinical rotations at 3 places. One is Chicago. In Chicago, we have 2 hospitals. And then we have West Virginia. In West Virginia, we have 2 hospitals, and then in Arizona, there we have 1 hospital in Arizona. Those are the current rotations available with Avalon. And we have 72 weeks of rotations. And you can do 48 weeks of core rotations and 24 weeks of elective rotations are required. Those are 72 weeks of total rotations. And most of the places in Chicago, you can do almost all 72 weeks. In West Virginia, you can do all 72 weeks except OBGYN in West Virginia. In Arizona, now I think with the current rotations, you can do almost 72 weeks in Arizona. Phoenix also, you can do all 72 weeks. So those are our current rotations. Other question that I see with the students is, I would like to do some rotations outside the Avalon system. You can do 12 weeks outside the Avalon system. We don't recommend and we don't allow more than 12 weeks outside the Avalon system. 12 weeks of rotations can be completed outside the Avalon system, preferably electives. You can do 12 weeks of electives outside the Avalon system. Maybe some people say that I have connection, I know somebody who can offer me rotations. You can do, but it's only 12 weeks of electives. So that's all I can say for clinical rotations. I can talk about clinical rotations for 1 hour. It could be another webinar, but this is the basic information. But if any student wants to know more information about clinical rotations, you're more than welcome. You can send an email to the clinical department. You can send an email to Dr. Wilson, who is our Dean of Clinical Science, or you can send me an email also. You see my email ID, you can send me an email.
Thank you, Dr. Arja. It was very great session, and I will compile the list of all the questions and will send it to you. And if any student want to ask any question, they can go ahead and ask. Then we'll compile, and Dr. Arja will be replying those questions. You can see his email address also on the screen right now. You can take a note. Almost every student knows Dr. Arja's email address, but just in case if you don't know, you can take a note from the screen. And session is handed back to Dr. Arja. Dr. Arja, all yours.
Thank you so much.
Remarks.
Thank you so much. Thank you for everything. Thank you so much.
Welcome.
Thank you. Thank you for everyone for attending the webinar.